Okay. Whenever you're ready.
We're rolling.
Waldo and Friends, in which a troubled young boy from Gary, Indiana, grows to early manhood and finds new dimensions to his life. Along the way, encountering a famous pop singer and a lovely and brilliant college freshman in a Southern California Jesuit school. Waldo. As a child, Waldo was not popular, nor even very well liked by his classmates and other children in his neighborhood. Occasionally he was made the butt of little jokes, or the object of whispered conversations, but mostly he was simply ignored. Waldo did not appear to be much bothered by his status. In fact, he rarely showed evidence of any emotion. Nobody outside of his immediate family, consisting of his father, Dr. Seymour Ralph, an optometrist, his stay-at-home housewife mother, Jenny Lynn, and two slightly older sisters, Agnes and Drusilla. They knew that deep inside Waldo actually felt sorrow or joy as deeply as anyone. It was that he simply did not have the ability to reflect these emotions to anyone else. He was a very different boy. His parents were convinced that he showed all the signs of a condition known as autism. And by the time Waldo was 4 years old, he had been examined not only by his pediatrician, but also by several child psychologists. None of these professionals could confirm the diagnosis. The results of the many tests to which he was subjected simply didn't fit the profile of autism, nor did they indicate any alternative diagnosis. In frustration, his parents ultimately abandoned their search for a convenient handle to attach to his behavior. He remained just a very different boy. Waldo Ralph went through kindergarten, first and second grades at the Emerson Elementary School as an outcast. He was intelligent and had no difficulty keeping up with the lessons at school. He participated successfully in oral discussions, but always with a flat affect which did not inspire much admiration from his teachers or the other students. Inside, he railed against his disability, wanting desperately to let out the feelings which raged within him, but he never once accomplished that. Then, mere days into his third grade year, the world changed for Waldo. His teacher for that year, Miss Horner, was completely unlike the motherly spinsters he had had in his earlier years. For one thing, she was young and blonde. He had not yet learned the words vivacious and sexy, but if he had known them, he would have applied them to Miss Horner. Just within his own thoughts, of course. In the brief classroom interactions they had, he was his usual quiet, polite, expressionless self. But sitting in his second row seat, his eyes never leaving his teacher, he soared rapidly and totally into love. He had never come close to such strong feelings in his life. Some insight warned him that age 9 was much too young for them to exist. But exist they did, far beyond his youthful powers to control. That year passed in a blissful cloud. Waldo's love for Miss Horner grew stronger and stronger as the months passed. even as his inability to bring his feelings outside of himself remained as solid a barrier as ever. He gained all the satisfaction he required through the excellence of his homework, for which she praised him, and for the inner feelings he was having. During the summer which followed, Waldo traveled by himself by train to a nearby larger city in which he had arranged an appointment with a renowned neurologist at the medical center. His parents knew nothing of his plan. Dr. Leibowitz saw Waldo on 3 occasions, took an extensive history and an exhaustive physical exam, and arranged for an MRI and CT scan of his brain. All of this was quite expensive, but Waldo paid for it out of his own pocket. He had 3 paper routes. The results of all these examinations proved eye-opening. Dr. Leibowitz discovered a tiny lesion in the pineal gland, itself a tiny organ 5 to 8 millimeters, about the size of a raisin, located deep in the inferior portion of the brain. The exact function of this gland was poorly understood at the time, but according to the neurologist, it was instrumental in controlling the expression of emotions. It was not a tumor, but a small healed tear, which had probably occurred at the time of his birth, a difficult forceps delivery. It was nearly certain that this lesion was the cause of Waldo's problem. The doctor was reluctant to discuss prognosis and possible treatment with his 9-year-old patient, feeling that he needed to bring in the parents for that. But Waldo insisted that his parents should not be informed, at least now, and persuaded Dr. Leibowitz to share them with him alone. After much debate, he relented. The prognosis was mixed. On the plus side, the lesion was static and would remain so. There was no potential for increase in symptoms. On the negative side, it was not going to go away on its own. The only hope for the disappearance of his symptoms was surgical removal. Because of its location, surgery would be long and complicated. The approach would have to be through the palate, at the rear of the mouth, and directly upward from there into the midbrain, or a newly discovered approach through the nasal cavity. Once at the site, removal of the scarred area would be dangerous and delicate, to avoid other significant damage to the gland. There was on the staff of this medical center one of the world's foremost pinealists who would undertake the operation, but of course only at huge cost. Waldo's response was externally non-committal, but privately he was certain that he would never allow himself to undergo such a risky procedure. He had been living with his problem, and he would continue to do so for the rest of his life, if necessary. In late August, classes for another year began at Emerson's school. Waldo Ralph stood among a group of students scanning the assignments to classes. He would be in the 4th grade. His teacher would be Mr. Donald Gypsum, new to the school. After absorbing this fact, and absorbing the reality that he would, for the first time, have a male teacher, his eyes strayed to the page including the lower grades. With a shock, he realized that Miss Horner's name was nowhere to be seen. The only third grade teacher listed was someone named Mrs. Littlejack. His heart sank. The summer, in spite of his distraction by numerous medical adventures, had in no way diminished his powerful love for the one and only Miss Horner. And now, was she not only not his teacher, but not even in the school? He reported as expected to Mr. Gypsum's fourth grade room, but at the mid-morning break he scurried down the long hall to the third grade room, cautiously peered inside. The students were all out on their break, but he could see an adult woman seated at the teacher's desk. Boldly he entered. He saw two things. First, on the chalkboard, the teacher had written her name, Mrs. Littlejack-Horner. He knew from several other classmates that women who married often retained their maiden names in this hyphenated fashion. The second thing he saw was the face of his beloved seated at the desk. So she hadn't left the school at all. She had only gotten married. He approached and was greeted warmly by Mrs. Littlejack Horner, who clearly remembered him from last year. She briefly explained her change in status while proudly displaying the 1/5 carat diamond on her ring finger and the slender wedding band next to it. Waldo could only stare numbly at all of it. As the bell rang to signal the end of recess, she thanked him for coming by, while inviting him to do so in the future, if he so pleased. There was no doubt he would indeed so please.